Welcome back to the Student Hub Live. Well, it's mid-afternoon on our Refreshers orientation event in February 2018. Now, we've been having a very full-on day. We've covered all sorts of things, and we've just heard from our STEM student support team. Zach and Mariah, I bet that's filled you with a lot of excitement about their fabulous T-shirts. And because you both work in the Faculty of Business and Law, are there any differences there with the way that they handle support for their students and the way that you guys do?
I would say, on the whole, our support is based on kind of advice and guidance, and that goes on to looking at not just the learning, so the module content and kind of policy issues that different modules might have and different bits and pieces there, but we also look at focusing in on the learner and their individual needs. So across the board, throughout all the different faculties and student support teams, you should receive an equal service when it comes to what we kind of care about and what kind of things and issues that we can help and support you with.
Well, I noticed you both got hats on.
Yes.
So are you preparing for the quiz later?
Yes.
Yeah.
Looking forward to the quiz later. We were just a bit jealous, actually, of John's knitwear on the last session of our STEM support team. So we thought, you know, we'd kind of, the programme manager got us these knitted up quick time.
Yeah, we're representing FBL here. So.
Yeah, that's it.
Oh, we don't even tomorrow we've got a widget for who has the best hat, but we don't have that today. So people can write in the chat. I bet you'll get the best one though, Amaro.
Thank you.
With the stripes. Very on brand though, I must say. It's all blending in very nicely. Okay, so in this next session, we're taking a look at studying with mental health difficulties. Now, this is something that Peter touched on this morning, our Vice-Chancellor, when we were talking about some of the social issues that the university hopes to address. Now, I'm going to talk to Emma Greenstein. You have the most fantastic job, Emma, in my opinion, because you're the Specialist Mental Health Advisor at the Open University, and you have responsibility, which sounds huge, with supporting staff to support students with mental health difficulties. And you're also very interested in promoting mental health and well-being. But a colleague from Health and Social Care is going to do that tonight. Yes. So that's in this evening's session tonight at 6 o'clock with Matthijs. So I wanted to specifically focus on studying with mental health difficulties in this session because an enormous amount of students experience mental health difficulties at some point or another. And equally, it's something that, unlike perhaps some physical disabilities, can sometimes be present for a certain time and then may, you know, either intensify or alleviate or even go away.
Absolutely. Students with mental health difficulties often experience great fluctuations in their conditions, and that's likely to impact on how well they're going to be able to engage with their studies. So there's huge variety. I mean, we've got about 10,000 students at the moment who've declared to the university that they have mental health difficulties, and that's really, really important because then we can work in partnership with the students to look at what support they're going to need, particularly if they're going through a bad patch. So the most common mental health difficulties that our students experience are depression and anxiety. Right. And students often start off in a relatively good place and then they find that they're enjoying their studies and that improves their mood. Maybe it's a really important part of their recovery. And then perhaps things happen in their life outside of the OU or they hit a rough patch with their studies and that can actually trigger a period of mental ill health and they may well need some more support at that particular time. So you're right, there's huge fluctuations and of course some of our students with mental health difficulties are also living with physical disabilities as well. So there's a real interconnection between physical and mental well-being.
I know a lot of students, I mean, depression is often followed by something really bad happening, often. But yet so many people will not have that diagnosed. And we're not sort of trying to promote having things diagnosed necessarily, but sometimes perhaps after a bereavement or something really, really bad happening, you can experience a period of depression, but some students might not have that diagnosed. Now, John and Annette were talking earlier about speaking to student support teams about getting some sort of profile and that can change over time as well. So you can sort of say something's happening for now and it doesn't have to be on your record forever, etc.
That's right.
It can, as the situation changes, so can that profile change. What advice would you give to students who may be suffering from something that might look like depression or anxiety, but that they might not have an official label for?
Okay, so that's a really important question that we shouldn't get completely hung up on whether or not somebody has a diagnosis. What we're interested in is what the impact on study is at a particular time. So you mentioned sort of bereavement and difficulties that students experience. And if they're going through a difficult time and it's affecting how they are engaging with their studies and they need support, you're absolutely right, they should speak to their student support team. If a period of low mood persists for a period of time, we always say the first place to go would really be your GP to get the right support. And if a student does receive a diagnosis of something like depression and anxiety, then it might be worth talking to the university about what adjustments we can make so that we can ensure that students have access to all of the support that they need so that they can achieve their study goals. And we do know that sometimes students go on to make a full recovery from quite an acute period of mental ill health, and then we can review that. They don't have a disability profile for all times. It can change, but it's really important that students get the support that they need through their medical practitioner and then with the European University in terms of adjustments that we can make so that the depression doesn't have to be a barrier to their studying.
Now, what sorts of adjustments can you make for these things? Because I mean, I know a lot about depression and things, and sometimes it's just bad,
Yeah.
And sometimes it can affect people in terms of the way they think that they may not be aware of. Sometimes it can really cloud your thought process or your ability to make connections, your ability to get out of bed, your ability to be motivated,
Yeah.
In addition to the various other things that are going on. So what can the university do? Because they clearly can't take away from that experience.
No. You mentioned motivation. Motivation and concentration can be a big challenge for students who are living with depression, for example. So sometimes it's about actually offering alternative formats of material to our students so that if they have periods of time when they really struggle to get out of bed, they can have audio versions of material, sometimes having comb-bound books so that they can fold the material round and study lying down. That can help. Sometimes it's just about having an awareness, having their tutors having an awareness of the struggles that they're experiencing so that a tutor knows that if they go off the radar to maybe drop them a friendly email to say, sorry I missed you at the tutorial, this is what we covered, please do come to the next session if you feel well enough, or for tutors to know that the student will attend tutorials but they're going to be struggling perhaps with confidence or not feeling very sociable, so to not put the student on the spot, to let them be there but not do that dreadful icebreaker where you go around the room and put everybody on the spot to say something, just to think about the activities that are planned so that the tutor knows actually this person's not in a great place at the moment, they're here but they just want to participate as and when they feel able to.
Yeah.
And then we have more extreme kind of adjustments that we can make around exam time. So sometimes students are struggling to leave the house. We can offer with the right supporting evidence, we can offer home exams, we can offer rest breaks, all sorts of adjustments. But it's about having a dialogue with the student early on to look at what might be effective for them, because no two students with depression or anxiety or any other condition are the same, and what works for one student might not be suitable for another one. So it's about taking quite a personalised approach and finding out what's going to work for the individual at a particular point in time, and that might change.
One of the things that I know you wanted to briefly mention was coping with distressing symptoms and side effects of medication. Is that something that might be on a profile, or how might that be incorporated?
Okay, so for some students, they are living with quite distressing symptoms that are going to affect how well they can concentrate or whether or not they feel able to speak on the telephone or engage with email dialogues or on forums. So the profile will give guidance to the tutors about how best to work with the student. So it might be, don't phone the student in the morning because they're struggling with their sleep and their best time to engage with others is in the afternoon, or that they need to study in short chunks, so that the tutor has some sense of the limitations for contact or when is a good time to engage with the student, and the sorts of activities that they're going to find difficult. So some of our students with great anxiety or social phobia may have confidence issues around engaging on forums or online tutorials, and just for the tutor to be aware that they might need a quick chat in the online room before everybody else joins, just to check in. So very little things, little tweaks, I always say, make big changes. It's the little things that we can do for students that can make such a big difference.
One of the things I know a lot of my students struggle with is this idea of perfectionism and wanting to do a good enough job, irrespective of whether there are any mental health difficulties at all. But sometimes that can provoke a lot of anxiety on its own because they want it to be good enough, etc. So sometimes when life can get in the way, or situations get in the way, or disabilities get in the way, that perfectionism can be a challenge. We've mentioned how the student support team can help prioritise and level and support students. What does your area add to that sort of side of things?
Okay, so we kind of sit behind the scenes and we will be advising the student support teams and tutors in terms of how to work with challenging situations like a student with perfectionism. And sometimes it's a bit left field. So sometimes a student will be asking for extensions so they've got more time to perfect a piece of work. And what I would be looking at with the tutor would be, is that actually going to be an effective adjustment? If we give somebody more time to get something perfect, they're going to be struggling for longer and in that state of anxiety for even longer, and then they're going to get behind. So much better really would be to look at strategies for working alongside having something like perfectionism, and encouraging the student perhaps to apply for funding for a study mentor through the Disabled Student Allowance Scheme, so that they can have a mentor to work with them to look at strategies for studying with perfectionism, so that it's not the academic support that they need, but it's really how to accept that something is good enough, and it's not about getting it perfect, but about showing competence and getting it in and getting the feedback.
Brilliant. So there's both support in terms of devising the right strategies, and tutors, I guess, are well known about what the weighting is for assignments and when it might be better just to do a good enough job and focus on something a bit later, but also in the support that they can get. And then also the Disabled Students Group, I mean, that's an USA group with the Students Association. They offer a huge range for both seen and unseen disabilities, and lots of support. And I know that mental health difficulties, as you say, are often comorbid, but they do offer support irrespective of what disability is there, and can be a really nice space.
Yes, definitely. Peer support. I think they're reviewing their peer support scheme at the moment, but that can be really invaluable. But I would really encourage students with diagnosed mental health disabilities to apply for Disabled Student Allowance funding. Those that get funding for a mentor tend to do way better than those without. I mean, a study mentor, one-to-one support each week, fantastic. It's not for everybody, but many students find that really beneficial.
Brilliant. Emma, that's been such a useful session. We've crammed so much in such a short space of time, but that was absolutely fantastic. Thank you for filling in those widgets in the chat, and I'm sorry we haven't had a huge amount of time to come into that, but we do have sessions on this evening with Mateus, as I mentioned earlier, which is all on promoting positive mental well-being in your studies, so I hope you'll enjoy that one at 6 o'clock tomorrow. And also we are talking to the Disabled Students Group tomorrow afternoon, so we can find out more about the sorts of services that they offer. We're going to have a short break now and change the tone entirely as we gear up for our quiz. So we're going to look at the funny thing about scientists, because we have some scientists upstairs, some planetary geologists in fact, who are going to play the Wheel of Ologies quiz against a team of librarians. So we'll join them upstairs for our quiz and see you in about 5 minutes after this short video.